Hello everyone. So today we will talk about compartment syndrome. So what is compartment syndrome? It is an increased pressure within enclosed osteospatial space that reduces capillary perfusion below level necessary for tissue viability. So basically compartment syndrome means increase in the intramuscular compartmental pressure which can damage muscles, nerves and blood vessels. We know that compartment is a closed area of muscle groups, nerves and blood vessels surrounded by fascia, and it is a normal pressure of 5 to 15 mm mercury. Here you can see in the diagram there is a compartment of the legs. Now we know that the limb contains muscles in compartments, right? It is enclosed by bones, fascia and interosseous membrane. So when there is a rise in pressure within this compartment, it can affect or jeopardize blood supply to the muscles and nerves. So when the pressure increases, it can damage blood supply to the muscles and nerves, which results in a compartment syndrome. Here you can see that the patient has a right lower limb compartment syndrome. The leg is swollen, the skin is shiny and glossy. There is an increased girth of the lower limb, right lower limb. Now there are two types of compartment syndrome. First is acute compartment syndrome, which is caused by severe injury or trauma. Acute exertional compartment syndrome have been reported in foot in runners, basketball players and other athletes. Then there is a chronic exertional compartment syndrome, which is commonly seen in lifters, rowers and welders. It is a recurrence of increased pressure seen most often in anterior and deep posterior compartment of leg. So the chronic compartment syndrome is commonly seen in the compartment of leg. Now what's the pathophysiology? So when there is an external or internal constriction, it can lead to the arterial spasm or occlusion, right? So there will be an arterial occlusion which can result in a muscle ischemia. Ischemia means lack of blood supply to the muscles due to arterial occlusion. So when there is a muscle ischemia, it can increase capillary permeability. And when the capillary permeability increases, it can result in an increase intramuscular edema. Edema means increase in fluid in an interstitial space. So when there is intramuscular edema, it can cause rise in a intramuscular pressure. So there is a fluid buildup in the compartment which will rise its pressure, and there will be a further arterial compromise. The artery will get more blocked, which results in a muscle necrosis. So necrosis results from a ischemia. Necrosis means death of the tissue, right? So it results from a ischemia, and the dead tissue of muscle is replaced by collagen, which results in a abnormal painful contracture. So here is the diagram or a cycle of the compartment syndrome. So when there is a reduced blood flow, it can cause ischemia, which also results from arterial damage, right? Then ischemia results in a edema due to increased capillary permeability, and it can also result from direct injury also. And edema can cause increase in the compartmental pressure, which leads to the certain symptoms like painful spots, pale, pulseless, paresthesia, and paralyzed limb. Now, what are the reasons? What are the causes of compartmental syndrome? That is a rise in compartment pressure due to any injury leading to edema of muscles, fracture hematoma within compartment, ischemia to the compartment leading to muscle edema, right? So when there is any muscular injury, it can cause a muscular edema, which results in a compartment syndrome. There is a fracture hematoma, which occurs after the fracture, and it can damage the blood supply, and there is increased capillary permeability resulting in edema and further compartment syndrome. Consequences: increased pressure compromises circulation, and there is a further muscle ischemia. So when the pressure rises, it compresses the arteries, surrounding arteries and capillaries, which can result in a further muscular ischemia. And it initiates vicious cycle which continues until total vascularity of muscles and nerve is jeopardized or damaged. It can result in a ischemic muscle necrosis and nerve damage. Necrotic muscles heal with fibrosis, which results in a contracture. So contracture means irreversible tightness of the soft tissue. Nerve damage can lead to the motor and sensory loss. There will be a muscular weakness and there will be a sensory loss. And in extreme cases, there is a gangrene. Now, how to diagnose compartment syndrome? So diagnose early by high index of suspicion after the trauma or injury. There is a excessive pain which is not relieved by usual analgesics or painkillers in patient with injury known to cause compartment syndrome. There are some common high risk injuries which can lead to the compartment syndrome, that is supracondylar fracture of the humerus, forearm bone fractures, closed tibial fractures, crush injuries to the leg and forearm. Now, what are the signs and symptoms? There is an increased sense of pressure and tightness in the forearm and leg. There is a progressive pain out of proportion to initial injury. So, the pain will increase and it will get severe. There is a markedly swollen area. So, the forearm or upper limb or lower limb will get swollen. There is a progressive neurological deficit due to nerve damage. We can remember 7 B's, that is pain, pressure, pain with passive stretch, paresthesia, paresis or paralysis, reduced pulses or pallor. Now there is one test which can diagnose compartment syndrome, that is a stretch test. It is the earliest sign of impending compartment syndrome. Ischemic muscles when stretch causes pain. Stretch by passively moving joints in direction opposite to the damaged muscle action. For example, passive action of fingers results in a pain in flexor compartment of forearm. Other signs are tense compartment, increased pressure in the compartment, hypoesthesia in distribution involve nerve muscle weakness. Right, there will be a hypoesthesia, decrease in the sensation, and there will be a muscle weakness. It is confirmed by measuring compartment pressure, which is usually greater than 40 mm of water indicative. Pulses may remain palpable till very late, should not provide false sense of security. We can palpate the pulse initially, but when the pressure rises continuously, it will get faded, right? We cannot then palpate it later. Now, how to treat compartment syndrome? Close watch for impending compartment syndrome, early preventing measures, limb elevation, active finger movements, right? Limb elevation and active finger movements will reduce the edema and it can decrease the risk of compartment syndrome and prevent complications. Early surgical decompression necessary in established cases. So we can also go for the surgery if the limb movement and limb elevation is not helping us. So there are two methods. First is fasciotomy, which is commonly performed. That is a deep fascia of compartment cut or slit longitudinally. Example in forearm. The second surgery is fibulectomy, in which middle third of fibula excised. It can decompresses all compartments of the leg. So it was all about compartment syndrome. Thank you.